Hello, everyone, and welcome back. I'm Kristen Finley, registered licensed dietitian and the owner of BeWell 365, coming to you from El Paso, Texas. Here today to increase your knowledge of health and wellness. Today is episode number 8 from our Facebook classes called Anti-Obesity Medications. Are they right for me? I have a shout out for my friend and colleague Stephanie for suggesting that I write this class. So never before have there been so many medication options for assistance with weight loss like today. The studies are quite literally unbelievable, and not only do some of these medications generate significant weight loss, but they also provide improvements for cardiovascular disease, diabetes, and kidney disease. Their potential is extraordinary. Now, with that being said, please be advised that these medications are very powerful and potentially dangerous. This episode will start with some background on obesity, then discuss the mechanism, the pros and cons of the medications, and what to look for when choosing a provider. A person whose weight is higher than what is considered to be a normal weight for a given height is described as being overweight or having obesity. BMI, or body mass index, is used to determine a person's status. So a BMI of 18.5 to 24.9 is normal or healthy weight. 25 to 29.9 is overweight, 30 to 39.9 is obesity, and 40 and above is considered severe obesity. For children and teens, the height weight percentile is used. Numerous experts, including myself, believe if the child has not reached puberty, then overweight and obesity should not be diagnosed. And healthcare providers should refrain from using the word obesity when talking to a child or a teen. The 85th to less than 95th percentile is considered overweight, 95th percentile or greater is obesity, and 120% of the 95th percentile or above is considered severe obesity. Data from the National Health and Nutrition Examination Survey, also known as NHANES, from 2017 to 2018 revealed that 73.1% of adults in America are overweight or obese, and 41.5% of children and adolescents in America are overweight or obese. There are many factors that may contribute to excess weight gain. We certainly can't name them all, but let's start with living in America, a country which requires very little physical activity or movement due to technology. The result is an extraordinary increase in sedentary lifestyles starting at very early ages. Next, America has a food supply dominated by highly processed and empty foods consisting of mostly simple processed carbohydrates, the foods made with white flour and refined sugar, which are very cheap and very satisfying. Then we add to that gender, genetics, environmental conditions, medical conditions, mental conditions, medications, sleeping patterns, access to and ability to afford healthy foods, as well as safe places to be active. Overweight and obesity increase the risk for many health problems, and the short list is type 2 diabetes, high blood pressure, heart disease, stroke, joint problems, liver disease, gallstones, some types of cancer, and sleep and breathing problems. In the past, the usual recommendations from the doctor are eat less and move more. Unfortunately, for many people, that is not the only answer. Anti-obesity medications were introduced as far back as 1959. Today we have 7 FDA-approved anti-obesity medications. The first one was phentermine back in 1959, with the most recent being tirzepatide in 2023. Today's class will be limited to the 2 most recently approved medications, semaglutide, also known as GLP-1, and tirzepatide. Semaglutide includes Wegovy, and for diabetes, Ozempic. Tirzepatide includes Zepbound, and for diabetes, Mounjaro. All 4 of these medications are once-weekly injections. Now, the mechanism of action is a bit technical, but I think it's really important. Semaglutides are GLP-1 agonists. An agonist is a chemical substance that binds to a receptor on a cell and activates a process. An agonist can be naturally occurring or synthetic. The medication is, of course, the synthetic agonist, and it mimics the hormone GLP-1, which is the naturally occurring agonist. GLP-1 is a hormone. It's produced in the intestines. It binds to a receptor on the pancreatic beta cells and helps regulate appetite and blood sugar levels. GLP-1 stands for glucagon-like peptide 1. Now, I'd like to show you a picture so you have a better idea. So this is a beta cell from the pancreas, and the receptor is right here. That's where the GLP-1 hormone or the medication would bind and activate the process of regulating appetite and blood sugar levels. And then I have a second picture which shows 2 receptor sites, again with the GLP-1 or the medication would bind at that receptor to activate processes. Tirzepatides are dual agonists, activating both GLP-1 and GIP receptors on the pancreatic beta cells. The GIP hormone enhances the release of insulin from the pancreas after a meal, essentially amplifying the body's insulin response to ingested carbohydrates. That just means that it makes the insulin work super well. GIP stands for glucose-dependent insulinotropic polypeptide. While both medications manage blood sugar, promote weight loss, and reduce hunger and food cravings, the literature suggests that tirzepatides help the body process sugar and fat more efficiently due to the dual receptor activation, and therefore may be more effective for weight loss. And sure enough, studies show average weight loss on semaglutide was 14.9% at 68 weeks at the highest dose of 2.4 milligrams. Tirzepatide had 22.5% loss at 72 weeks, again at the highest dose of 15 milligrams. Dose parameters per week are a little bit different for the 2 medications. Semaglutide is 0.25 to 2.4 milligrams weekly, and tirzepatide is 2.5 to 15 milligrams weekly. A promising study was done through Veterans Administration by Ziad Al-Ali and colleagues called Mapping the Effectiveness and Risks of GLP-1 Receptor Agonists. It appeared in Nature Medicine, and revealed 175 positive outcomes. That's mind-boggling. No one was prepared for that. Now, please keep in mind that this study population, being from the VA, was predominantly men who had diabetes. The average duration of follow-up was only about 3.5 years. There is no long-term data at this point. But let's review a few of the positive outcomes. Besides the known reductions in weight, cardiovascular, and kidney disease risks, additional benefits included reductions in septic shock, liver failure, schizophrenia, opioid use disorders, alcohol use disorders, hemorrhagic stroke, suicidal ideation, and pulmonary embolism. The study reported profound effects on appetite, leading to substantial weight loss from 10 to 20% of body weight, but also curbing other appetites. People taking these drugs are more likely to quit smoking, drinking, and gambling. Even less compulsive shopping was reported. Some people are calling these drugs anti-consumption drugs, or the antidote to the central problem of current culture, overconsumption. Another huge benefit of these drugs is that they have been known to stop food noise. So what do we mean by that? Food noise refers to constant, intrusive preoccupation with thoughts about food, often characterized by excessive focus on what to eat, when to eat, and where to eat, even when not genuinely hungry. Many people who are struggling with obesity suffer from excessive food noise. It's also described as constant mental chatter about food and can be quite difficult to quiet down for some people. It might be triggered by seeing food ads or just being around others who are eating. But before you run out of the house to your doctor to get, a prescription, let's review the downside to these drugs, starting with a significant decrease in appetite, and for some people, a complete loss of appetite. That means that one must eat in the absence of hunger. Trust me, that's harder than you might think. So let me ask you a question. What is perhaps one of the most pleasurable things that we have in life? Well, it's eating, of course. Enjoying a well-prepared, delicious, and beautifully presented meal with friends or family is at the top of the joy list for many people. It is for me. Just the anticipation of such a meal can be remarkable. Some users of the meds report only eating half a piece of toast for breakfast, a cheese stick for lunch, and a couple of crackers for dinner. Even the intake of fluids becomes a chore for many people on these meds. The result is dramatic weight loss. Unfortunately, the majority being loss of muscle mass. Many experts, including myself, believe that muscle mass is the fountain of youth, which happens to be the topic for our next Facebook class. More information on that in a bit. So when food intake is that diminished, there is no energy to do exercise. Without weight-resistant exercise, preserving muscle mass is almost non-existent. It's just not going to happen. These medications are long-term, and that means pretty much for life. The literature that I reviewed reported that weight returns when the medications are stopped, much like lifestyle change. Nausea, vomiting, and constipation are the most prevalent GI side effects, but we also see diarrhea, acid reflux, and abdominal pain. The VA study showed a higher rate of musculoskeletal problems, kidney stones, headaches, and bone pain. But not that worrisome, according to that study, because they can be treated. It's important to note there is a very high risk for developing an eating disorder, which should be screened for at regular intervals. The medications are expensive, not often covered by insurance. They cost roughly between $1,000 and $1,800 per month for a weekly injection. That's 4 to 5 injections. that would be a hardship for most people to maintain. So that's when the black market meds come into play. I've heard several advertisements that seem very attractive. You probably have too. But we don't recommend this course of action. And I repeat, we do not recommend black market anti-obesity medications. They claim the meds contain the same active ingredient as the brand name meds, but the amount and the inactive ingredients are often unknown. The brand name meds have been extensively studied for years by their respective pharmaceutical companies before being FDA approved. These extremely powerful meds can be very dangerous when not prescribed and followed by a physician, and when the patient is not followed by a team, including a registered dietitian. So why a registered dietitian? Well, we are the food experts who can teach you about nutrition and the macro and micronutrients necessary for the human body to function properly. What good is weight loss if, it's so rapid that you become sick with no quality of life and you look like a walking skeleton? You can Google Sharon Osbourne, the wife of musician Ozzy Osbourne, for an example of what can go very wrong when using these medications. So how do we decide? Well, let's go through some important steps. The prescribing physician or qualified provider should take the time to discuss all the pros and cons of the medication being considered, including other weight loss medication options. In addition to a complete medical workup with labs, there should be a mental health and eating disorders screening before starting the meds, with follow-up screenings at regular intervals. There should be a registered dietitian as part of the team. The RD should provide a complete nutrition assessment and education on diet to include nutrition quality and hydration, a full explanation of exercise, and the importance of weight-resistant exercise to preserve muscle mass is imperative, including follow-ups to monitor the amount and the speed of the weight loss. There should be education on medication administration, including dosing, storage, disposal, injection site, technique, and strategies for managing side effects, traveling, and holidays. The safety and effectiveness of the medication should be assessed monthly for the first 3 months, and then after that, every 3 months. So, are these miracle drugs? Well, I'm not going to attempt to answer that question, but now you have enough information to find the right provider and make an informed decision. And that was our goal today. Awareness of the medications, how they work, the pros and cons, the potential benefits, as well as the dangers of these powerful and promising medications. That's all we have for today. The next Facebook class will be Thursday, May 1st at 3 o'clock p.m. Mountain Standard Time, so mark your calendars. It's episode number 9 called Chasing the Fountain of Youth. We'll keep you posted. Our Wellness Wave subscription service on our website, bewell365.com, is now available. The subscription includes 2 classes per month, with one of them being a live streaming Q&A session. So if you or someone you know is struggling to make and maintain lifestyle change, why not spend some time with us each month? We'll keep you inspired. Thanks for connecting with us today, and we'll see you next time. Bye for now.